The humerus is the long bone in the upper arm that extends from the shoulder to the elbow. It's a crucial part of the appendicular skeleton, connecting the scapula, shoulder blade, and the two bones of the forearm, the radius and ulna. The head of the humerus is the uppermost, rounded, and smooth part of the humerus, the long bone of the upper arm. It is a crucial anatomical structure because of its role in forming the primary joint of the shoulder. The humerus has two important necks at its proximal upper end, each with distinct anatomical locations and clinical significance, particularly concerning fractures. The greater tubercle and lesser tubercle are two prominent bony projections located at the proximal upper end of the humerus, just below the humeral head. They are crucial landmarks because they serve as important attachment points for the muscles of the rotator cuff, which are essential for stabilizing and moving the shoulder joint. They are separated by a distinct groove called the intertubercular sulcus or bicipital groove, through which the tendon of the long head of the biceps brachii muscle passes. The radial groove, also known as the spiral groove or musculospiral groove, is a shallow, oblique depression on the posterior surface of the shaft of the humerus. It spirals downwards and laterally, providing a passage for two crucial structures, the radial nerve and the deep brachial artery. The deltoid tuberosity is a rough, triangular-shaped prominence located on the anterolateral surface of the middle third of the humeral shaft. Its primary function is to serve as the insertion point for the deltoid muscle, the large, powerful muscle that gives the shoulder its rounded contour. The shaft of the humerus is characterized by three surfaces, two of which are located anteriorly: the anterolateral surface and the anteromedial surface. The anterolateral surface lies between the anterior and lateral borders of the humerus. The trochlea is the spool-shaped, medial portion of the distal humerus, forming a crucial part of the elbow joint. The capitulum is the rounded, knob-like, and smooth articular surface located on the lateral outer portion of the distal humerus, forming part of the elbow joint's condyle. It specifically articulates with the cup-shaped head of the radius. This articulation, known as the humeroradial joint. The medial and lateral epicondyles are two prominent bony projections located on either side of the distal humerus, just superior to the trochlea and capitulum. The medial epicondyle, larger and more prominent, is found on the inner side of the elbow and serves as the common origin for most of the forearm's flexor muscles. The lateral epicondyle, smaller and on the outer side, provides the common origin for the extensor muscles of the forearm, e.g., extensor carpi radialis brevis, extensor digitorum, and the radial collateral ligament. Both epicondyles are crucial for anchoring the muscles that control wrist and finger movements, making them susceptible to overuse injuries like golfer's elbow, medial epicondylitis, and tennis elbow, lateral epicondylitis. The radial fossa and coronoid fossa are two distinct depressions located on the anterior, front, surface of the distal humerus, just above its articular surfaces, and are crucial for full elbow flexion. The olecranon fossa is a large, deep depression located on the posterior, back, surface of the distal humerus, directly superior to the trochlea. It serves a critical role in the full extension of the elbow joint,